Hello students, Instructor Pamela here. I would like to give a career connection update or news, shall I say. Keep in mind, students, that being a healthcare professional on the administrative or non-clinical side, you are actually learning 10 different positions within the revenue cycle. And the revenue cycle is the same across the board for inpatient and outpatient, as well as all other businesses that exist in our economy. So meaning there is a track of documentation of basically billing purposes. So when you go into healthcare, you are dealing with creating claims that we will be submitting to an insurance carrier for reimbursement. So with that being in mind, patient demographic information will be collected and then used to turn around and basically create a claim and a bill so we can get paid for the services provided to the patient. So your revenue cycle includes registration or scheduling. So if you are making an appointment to see the doctor, we schedule, so you'll actually be calling a number or logging onto a website to create your appointment. And then if you are going into the emergency room, you would actually be registered when you are called to the desk, and then there you'll present your identification and your insurance card to the registrar. So these are very critical positions. These positions are needed across the board for every single healthcare facility, whether if it's a doctor's office, a radiography center, a surgical center. We need schedulers and we need registrars. Now your step 2 also includes insurance verification. So there you can work at insurance companies, you can work for a facility where you're verifying benefits for the patients that are coming in. And then if you are actually working at an insurance company, you will be providing quotes to the insurance verifiers that call from the facilities. So, and you will be collecting patients' effective date, how their insurance will reimburse for the services provided. If we wanted to know if there's a pre-certification that needs to be done before the patient is seen. So all of this information is communicated in step 2, which is your insurance verification. Step 3 includes the check-in process. So again, depending on where you're going or working, will determine how the check-in process works. There, the patient provides you the identification, the insurance card, patient signs any paperwork that needs to be done, and then they basically wait to be seen. And step 4 is your check-out procedure. So depending on where you're doing the discharge, will determine on how that procedure goes. If you're at a doctor's office, you basically receive your medication script if needed, any appointments that need to be followed up with, and any other additional paperwork. So in step 3 and 4, the patient's actually treated for the clinical part. And we move on to step 5, which is the coding. So depending on where you're working at will determine what you will be coding, whether if it's inpatient coding or outpatient coding. From there, step 6 basically includes the billing. We finalize the claim to ensure there's no errors, and then the bill gets forwarded on to the clearinghouse. The clearinghouse then forwards it on to the insurance payer for processing, and that is step 7. So basically the claims adjudication process happens where the insurance decides if they're going to reimburse it or deny. And then your step 8 includes the payment posting, where the facilities receive their money, we post the accounts, close them out, we generate patient statements in step 9, and then step 10, we do collections. And we collect any money that is owed to us. So keep in mind, students, there are 10 different positions that you can work in the facilities and inpatient and outpatient, as well as many other businesses or sectors that work with healthcare, such as the insurance companies, the government. So you are in an awesome field. Listening until next